award letter information, process, etc., associated with the CARES grants, and those are going to be starting to head out the door tomorrow. So hopefully this information is very timely. We're extremely excited to be working towards getting these funds into providers' hands. So Betsy, I'm going to turn it over to you.
Awesome. Thank you, Joan. And I would like to comment on your ear cans. I think this is a new look for you, and I'm liking it. Looks so hip and modern. So I am going to go through a few slides with everyone today just to kind of let you know about the plan for this week for the communications rollout of the awarding information regarding this emergency childcare grants, and let you know kind of what's going to happen, what's not going to happen, and kind of what to expect and how you can be supportive of our providers through this process. Can everyone see my screen? Okay, great. So starting tomorrow, we will be letting what we're calling the first round of grantees know that their application has been accepted and that they will be receiving a grant award. So not everybody is going to find out the fate of their application tomorrow. Just to set the stage, we had over 2,000 applications come in. Tomorrow we will be sharing good news with just over 1,200 of those folks. So there's still some people that we need to continue reviewing their application. We will not be sharing any bad news tomorrow. It's only going to be good news. Those that do not receive information, we're just still reviewing their application. So I'm sure we'll get some questions because so many people will get an award email that those that don't, I'm sure there'll be some anxiety and some worry. And the truth is, we haven't got through them all yet, so we just need to continue working to get those out. So the process I'm going to outline for you right now, we will do the same next week with with that next wave of folks. So tomorrow, this 1,200 group of 1,200 are going to get an email through our application system that is going to say, yay, you're getting an award, and here are the next steps. And there's some key pieces of information in there. And one is that they need to gather some information so that when they get to the point of signing the documents, that can go smoothly. And the two pieces of information that they need to really gather is that not that they have to gather the information, but the two things that they need to get prepared for is they need to gather their tax ID number or their employer ID number, and they need to get a DUNS number if they don't have one. Now, you probably all have a DUNS number for your organizations, and some providers do have them, but most of them probably don't have them. So I'll talk more about DUNS numbers in a minute, but this is going to be where you can be most helpful and supportive to folks, is to help them through this DUNS number process. And we've created a step-by-step guide on how to do that. And I'll show you where that is and how to do that in a minute. On Friday, we're going to follow up with another email to folks. And this will actually be the paperwork for them to sign. This will be the grant agreement itself. And it will also be a W-9 form for them to complete. This will be an all electronic signing process. We're actually using DocuSign. Maybe some of you are familiar with that. So it's clicking, they can use their finger, they can do it on a smartphone, a tablet, a computer. So that part should be fairly easy if they have done the other two pieces, have their DUNS number and have their tax ID or employer identification number. They're gonna have to input those two numbers in order to complete the signing process. So Wednesday, the good news. Friday is when the first time they'll be able to get the signing process done. Checks will come our goal, 10 business days following us receiving the completed paperwork. So that's our goal. I wanted to alert you to where we ended up on the actual awards. So this table we had in the original RFA, but it didn't include the right-hand column that says the actual awards. So it only included the middle column. And so we had these goal amounts that we were planning on awarding, but we also included this footnote at the bottom that says, awards may be prorated at a higher or lower rate based on available funding. Well, guess what? We had a lot of people apply and a lot at the higher ranges, a lot of classrooms. So in order to get everyone in and fund everybody that has qualified, we do have to prorate the amounts down to stay within our budget. So these are where the actual awards are coming in at. So we'll be communicating that with folks tomorrow. You may hear about that, and this is just very transparently with you why and where we're at. We have to stay within our $8 million budget that we were approved to spend. Let's see, next is how you can help. So on our website, there's a grants section of the COVID page. And we've added a new section today called For Grantees, and we put a few resources there that I definitely want you to be aware of. The sample agreements are down there. So these are the actual agreements that folks are going to be asked to sign through that DocuSign process. We will highlight that for folks in the first email. So if they want to look through it ahead of time before it's time to sign, they can do that. This is a resource I definitely want you to be aware of, so that if you are helping people through understanding what's in the agreements, or they're actually pretty short and simple agreements, but if there's any TA to provide folks, that's where you can find them. And then this here, this DUNS number guide, the Spanish version will be going up soon. It'll go up today. But here's the English version, and this is where we prepared a step-by-step guide on how to get a DUNS number. So the DUNS number it's a unique number that's provided by Dun & Bradstreet. Like, I actually didn't even really, I've heard of a DUNS number, but I actually didn't even really know it until I started really getting into it to develop this tutorial for the childcare providers. And first off, there's no way around it. We've tried every single way to try to not have people have to get this thing, and that's unavoidable. It's required by the feds. We have to have it because it's federal money, and there's no way around it. So I wish there was. It just can't happen. So we have to have it. It's a unique 9-digit number that's provided by Dun & Bradstreet, in case you're interested. And frankly, it's a good thing for them all to have anyway, because if we have another round of grant funding, they're going to need it. Even if you're working with providers who aren't in this situation, it would just be a good thing for them to have. Like, businesses should have this DUNS number, as it turns out. So it's not a bad thing to just do when you're not under a time clock pressure. There's two things. So it's an online system. They have to go through a little online form to get it. It takes a couple days. These instructions are like 10 pages long because they have big screenshots in them. So I don't have them all up here, but you can find it on our website. The main thing that's the real pain in all this is they have to upload 2 pieces of documentation. And it has to be documentation that shows your physical address matches your business address. So, or your business location. So like your business, it has to tie your business name, which in a lot of these cases will just be their personal name, to their physical address. So it has a long list. Things like utility bills, magazine subscriptions, lease agreements, insurance documents. There's a long list of things you can pick from. You have to have 2, but there's logistics involved here of having them on your computer, being able to find them, click them, upload them, these kinds of things that you got to do. So that's not ideal. Let's just call it what it is. This is not where we want to be right now. but that is where we can all be supportive in helping people through this part of the process. Literally, this is the biggest hurdle we have between where we are today and getting this money in their hands, is getting these documents uploaded and getting this number. So I wanted you just to really ask for your help and let you know how to find the information so that you can help people through that and support them. We will continue updating our FAQs on our website. We have been this whole time. We'll continue to do so. We'll also be triaging, our email. So as you get questions, including on grant status, just send them to the email so we can get directly back to people. And that's my high-level overview. I'm happy to take any questions.
Are there any questions? Karen Hinkemeyer.
I appreciate getting this information before it goes live. Thank you very much for doing that. I do want to help you understand the perspective of those of us SDAs that have individuals that speak a language other than English. This is going to be a really heavy lift to support the individuals. I just want you to be aware of that and know that that does take a lot of time for our quality improvement specialists to support.
Thank you for that. I will tell you that yesterday when I called the Dun and Bradstreet people myself I was poking at them every way I could to see how easy we could make this. They do have translators available in many languages. So that's something, and we've put that in the guide, but that's something for everyone to be aware of. And we are making the guide available in just the 2 languages. So again, I will fully own and recognize that we are not in an ideal situation. And I also, and I should have said this at the beginning, really want to thank you all for all of the TA that you provided during the application process. And clearly, your work was very successful because our program is very oversubscribed. We had a huge turnout in the applications among especially licensed providers. I mean, we're at the top of those who could apply, did apply. And I have no doubt that that was because of your assistance that you provided. I'm also sure that we probably left some people behind because of the technology divide and the language barriers. And that's just something that we're going to have to continue to work on with every single project that we have. So we're nowhere near where we need to be, and we are very aware of that. I think we just got to continue to lean into it at every chance that we have. So appreciate your comments, Karen.
Thank you, Betsy. I see Jerry Wolf.
Okay, so I have a question. So if we have some providers who don't get that letter this first round and contact us, should we go ahead and have them start the DUNS process just so that they're at least that step ahead if indeed they get the grant?
I would. I had this question earlier today. I think that is something that I actually would advise. I need to think through better how to, maybe retool that DUNS guide so it's more generic and not just toward this one grant this one time, and maybe get it in all 5 languages and just have it out there as a constant resource, because we are trying to get another round of these grants targeted for another group of folks. They're going to need these DUNS numbers too. So a long answer to your question, I think there's a lot of uses for these numbers. As long as we've got money available, you never know, someone could be eligible and it would be a good idea. I think right now, also though, recognizing you're going to have probably a crush of TA for a group of people where it's very time sensitive. So that'll be up for you to kind of manage who you can help and maybe who you could help a little bit later.
Thank you.
Betsy,
Thank you,
this is
Betsy
Joan.
and Jerry.
Could you talk about any role that licensors or other staff from the Office of Childcare will also be playing?
Yes, thank you. So we definitely divided the roles between you all during the application process. Really wanting to make sure that the regulatory side was not involved in the money, applying for money side. But now that we're on the other side of that, and these are folks that have been approved, we definitely are asking the licensors to help in this same way as we're asking you to help. So it's like all hands on deck for helping people get these DUNS numbers. If there's any assistance for those who have been approved, really there's no wrong door as far as I'm concerned.
Great, thank you. Are there any other questions for Betsy? I'm not seeing any hands or dances. Oh, yes, I am. Shannon. Sorry about that.
It's okay. It's hard to see on there. Can you hear me?
Yes.
Yes.
Okay. I'm not sure if this has been asked. So oftentimes providers may not have a computer, and then we help them submit. Can we help them submit this stuff through our computers, or does it have to be their?
No, yeah, you can for sure. I think the thing to be aware of is that there's going to be several steps that are going to continue to involve technology from here on out. So there's the Wednesday notification. Then there's going to be the DocuSign process starting on Friday, and then after that, on their first check will be 50% of their total award, and then we go into the partial payment and interim reporting cycles. So in June, they're going to receive an email. So if you're involved in this, you just need to be aware of kind of what you're signing up for. So in mid-June, we're going to send an email out to folks with some sort of little clicky like report with a couple questions. Are you open and are you serving children? Basically is what we need to know. And they're going to get those payments unless they say yes. So they need to answer that. We got to receive that back. We will do our best to make that very easy. And then those second and third payments will go out in June and July. We'll do that same process twice, once in June and once in July. So all of that, those are all electronic steps I just outlined.
Okay, and Christine.
Is there a way for you or somebody to send a list of people that have been awarded the grant so that we can reach out and help them?
Yes, there is.
Okay.
I'll send it to Joan tomorrow.
Thank you. I appreciate that.
So this would just be the list for the folks for this week.
Yes.
Next week we would have a different list.
Okay.
And something else, I don't know how licensors are going to have the same list. So how you all coordinate and, you would have to all work that out. So.
This may, on that note, this may be a good time to just be very proactive and connect with your licensing specialists and your QISs and say, how can we kind of triage or coordinate supporting getting the DUNS number, supporting getting the paperwork done. So that may be a good step prior even to getting the list, or once you get the list, whichever works out best. Okay, Robin.
I would just offer, we do have staff that speak multiple languages that could help support as well. So if you're feeling like you're not going to get to all of the providers in your area, or the licensing specialists aren't either, please reach out to us, because we could support you in this and support some of those providers as well. We've done it with other pieces, and we don't want to double do and have too many people calling all the providers, but definitely reach out to us if you're needing more support on reaching out to providers and getting them through this process.
I will tell you in terms of volume, out of all of the applicants that submitted, About 129, I want to say, applied in Spanish and noted that their preferred language was Spanish through the application process. I don't know how many of those will be in the group tomorrow. I will have those numbers, but I don't have them yet. Just so you have order of magnitude numbers.
Okay. Thank you, Betsy, and thank you, Robin, for that resource as well. So do we have any more questions for Betsy? I see no waving hands or chats, I don't think. Great. Well, Betsy, thank you so much. As always, your presentations are so clear and encouraging and supportive. And also, this is really great news that we're getting money to providers. And who knows, maybe the DUNS number is kind of a step towards professionalism, and we can really be working on that with that frame or that mindset as we move forward. So
thank you. We have a lot of steps to go, a lot of little tiny logistics to actually get the checks out. So just like positive thoughts. Thank you.
I did see Mary Wolf wave her hand, though. Sounds like there might be one more question, Mary.
And I apologize if this has been answered, but you're checking again before they get the additional checks out, but the ones that were open and got that initial payment, they have that regardless, correct?
Right. So everyone will get that first check. That's right.
Thanks.
Yep.
Great. Thank you, Betsy. Okay, so I will go ahead and take the screen back.
Hey, Marge, I see that Hannah may have a question.
Oh, I missed that. Sorry, Hannah.
No worries. And then Karen also had her hand up. I was just going to say, we have the directors meeting on Thursday. Do we want to spend like the first half hour dividing up if people need to take on TRI to support any other providers and reaching out? I just wanted to say we have that time and we can quickly go through the list. Everyone's nodding. Okay, make it a working agenda. Perfect. I'll add it on and we can get it organized so we can support.
Thank you, Hannah. Joan, I think you're on mute.
I was going to say, it would be ideal then if all of you had actually talked to your licensors before that point too, because they're as fired up as you are, I am sure, to help people, and they know the challenge that this represents. So I think really coordinating with them and Western is where it's at. Like, that's the sweet spot we need to get to here, so that we can help people through this process as expediently as possible.
Great. And John, did you say someone else was raising their hand?
I think Hannah said somebody was, but I'm not certain who she said because I was speaking over her while she said it.
It was Karen Hinkemeyer.
Sorry, Karen. I can see you all better now.
Yeah, I just really wanted to say thanks for people stepping up to the plate to help support. I think the coordination of it is essential and we need to move on that first, you know? And so I do appreciate people stepping up.
Hey, I had one question somewhat related to this of the directors, just to get a sense or a pulse on how many providers that speak other languages other than Spanish may have had help to submit it in English. Do we have a sense of how many that might be? Are we talking about 5 providers each region, 100 providers? You know, I mean, just a little bit more info would be nice on helping the ELD understand what this means for other language providers.
Sean, this is Christine. For us, it's probably 150 to 200.
And multiple languages, most likely?
All 7.
Okay.
Christine, just tell your team, amazing work. That's incredible. I know, that's a heavy lift.
They may drop after this one.
Oh, gosh.
They're tired.
Yeah. Yeah.
This is Shannon.
Go ahead, Shannon.
Oh, sorry. It could be probably 50 to 75 for Russian and Spanish on our end.
Okay. Thank you. Yeah, so Karen Hinkmeyer, were you going to say something? Sorry.
No, I wasn't.
No, it was me.
Oh, okay. Sorry, Jill.
That's okay. I just really wanted to pick up on the thread here around, to the degree feasible, communicating a positive frame around this, right? So not, oh my gosh, this is a horrible hurdle. I'm making stuff up. None of you would do this, but this is a horrible hurdle. We have to get you through, right? Like, that's not what this is about. This is about I think, staying focused on getting access to these federal dollars and potential future federal dollars. This is what you have to do to receive a federal grant. And we hope that you would have opportunities to receive federal grants in the future. I understand that's not going to make the day-to-day work of doing it with folks easier, but I think trying to have a bigger picture frame for people, to the degree feasible, will be really helpful going forward. The other thing I would say is, obviously, you'll all look at the guide. I think that a fair amount of thought went into trying to create that guide to make it as simple as possible. But of course, you may have some ideas on how to even simplify it more that, might be helpful with your staff. So really look at the resource that was created and think about how to, do your best to use that. So I think the opportunity is here to really have people both get this and then also to be better positioned in the future for funding.
Great, thank you. All right, anyone else? Any last thoughts, words, comments? I do want to note that Lynette brought up the regulated subsidies. Providers may need the extra help as well. So that's just another thing to remember as you're coordinating with licensing specialists and moving forward, which I'm sure you've all thought about. Okay, so let's go ahead. I did change the agenda. I know Jen has to leave within this first hour. So I know there's been conversation and some questions around DHS payments and as we're moving forward. So Jen, are you on?
I am.
Or
Hi.
Regina? Oh, great. Hi. Hi.
Just looking to pull up the questions that we had gotten earlier. And so these are really good questions that came through. And they're ones that we've received a few different times from different areas, but Christine sent them through. So one of the questions was just essentially asking about like policy updates for June and ongoing. And really at this point in time, the policies that we have in place will remain in place until we can properly notify people of changes. So it's okay to take those as ongoing until notified otherwise. And we may have dueling conference calls here in just a second. So sorry. The joys of working at home. And so for now, I mean, that has to do with the zero copay. It also has to do with the coverage of absent days and closure days as well. One of the other questions, just asking if we'll be able to continue paying for families that are not able to attend due to COVID-19. And so that's kind of along the same lines as the absent day and closure policies are going to remain in place until we can send notification out of any changes or new policies or that are coming forward. Let me just pop in here. Any questions about that so far? I don't want to just buzz right through.
Oh. Christine.
Thanks, Jen. I'm curious if you have any idea like how much notification people will get. We just have a few people calling scared that it'll be like May 30th for June 1st.
No, I mean, there's our ideal timeframes on issuing issuing notifications, which in my mind, I would love to have letters out at least a month in advance before a change is happening. but I'm not sure that we're going to be afforded that kind of luxury. I think anything less than probably about 2 weeks to 10 days before the end of a month when a policy is changing the next month is going to be cutting it too close. So I can't make any guarantees. I can promise that we will definitely be pushing back if we feel like the notification timeframes are too short. But with some of these, especially being tied to budget questions, I really don't know what exactly our timeframes are going to be. But we have to allow enough time for letters to get out, and not only that, but to get out to every area of the state, because some places take quite a bit longer for for mail to make it there. And so providers shouldn't be receiving a letter the day before a policy changes. That's just unfair and not something that that we want to do to our providers or our families when things change.
Thank you.
I just lost.
Okay, I'm not seeing, oh, I am seeing another question. Eva.
Just wanted to see if the 250% of federal poverty level is part of that no change until further notice, or if there's anything different there.
Yeah, all of the changes. So that includes the zero copay for all families, the higher income limit, the extended absent day policy, and then the coverage of closure days. Am I missing something, Regina? I think that's everything.
No, I think you got it.
I think that's everything we've changed. Yeah, and some of those cause less concern for me than others. So the higher income limit, that one really doesn't have as much of a fiscal impact as things like a zero copay for all families. The zero copay for all families, it costs a lot to maintain. And so some of those we're actually hoping to keep longer than others, but we'll see. And then we had, let's see, the third question was a really good one. So this is talking about, I'll just read it out. It says, we have families who are not working now due to COVID and their ERDC renewal date was now. So they were denied since they don't meet the work requirement. I assume they just reapply when they return to work. And so in this instance, providers would not be paid. So this is a really great question because within the ERDC program, we have the authorized work search period. So when a family has been either laid off or lost their employment, they are able to maintain their ERDC benefits for the typical time frame is about 3 months. I am going to say that these are case-by-case basis because some of these can go longer, but some may also be shorter, and they would be shorter if a family doesn't report timely. So we're running into a lot of situations where families just aren't telling us that they've lost their employment and they're letting their cases close. They might be telling their provider that they've lost employment. They might be telling the R&R, and so it makes it appear like they're not getting the benefits they're entitled to. But when we start looking into what has been reported to us, we have no record of the job loss. So in the ERDC program, it does say that they're required to report job losses within 10 days of occurrence. This goes out in their approval notice at the very beginning. When they're approved for benefits, it lists off all of the required things that they must report. And if they report that timely, then essentially we start the authorized work search period the month following. And then if they had a copay, we would look at potentially adjusting the copay in the month that they lost the job, but that's not necessarily a circumstance right now. And that authorized work search period, so that can hold their case open for up to 3 months past their certification date. And so that's why it's such a key point, because if someone's recertifying for ERDC and they're not working, we do have an employment requirement. They must be receiving income from employment, and if they're not, their application is denied. So that's why we made that policy extend the certification date. That way a family wouldn't be getting an authorized work search period in one circumstance, but if their recert fell at the wrong time, they wouldn't get it. So we intentionally made that policy so that all families would at least get the 3 months. But like I said, we are running into families not reporting. In some cases, we can still authorize the remaining part of that period. So if they reported late, but they still had 2 months left, we can still put them on that. But if they report and their case is already closed and they're reporting after the fact, we can't, since the authorized work search starts the first of the month following the report. So if their case ended April 30th and they report on May 1st, hey, I lost my job back at the end of March, then we can't necessarily go back because their case is already closed. So reporting timely is absolutely key in these cases. Regardless, if you come across families that are saying that this is the situation, either ask them to contact their branch office and ask about authorized work search, or send that case information to the child care policy box, because we will look into those. If we can get cases reopened, we will. And so that's been kind of a hot topic, and it's been something that's been it's been a little bit hard because it is key on families reporting to DHS timely. And I know some families, especially if they've lost their job, that's not the first thing on their mind to call up DHS and tell us, but it does make a big difference on making sure that families get the most out of their ERDC program benefits. And then also we do have some situations where you know, the ERDC case closes and the family just chooses not to reapply, or in cases where they have applied for TANF benefits, but they didn't set up a jobs plan where they need childcare in order to do the jobs plan, then those families just aren't eligible for childcare subsidies anymore. And if they're not eligible, we can't pay. So that's another part that's been coming up too. And then I believe the last part is, will programs still collect or receive payment if they're closed due to COVID-19? And we are able to continue payment if the program is still connected to a DHS eligible family. So in some cases, we have families who have started working from home. They're just not taking their children to childcare, and their childcare has closed down due to COVID. Those providers, they still have an active connection unless, you know, they either report to DPU that they're no longer providing care or the parent ends the connection. But those connections will stay active, and the provider can continue to submit billing forms for the time that the child would have otherwise been in care. So for scheduled time that they were going to be there. And again, if the family becomes ineligible for child care subsidies, we can't give benefits to someone who's not eligible, and that's not just for childcare, that's across the board with every DHS benefit. We can't issue it out for ineligible families. And so that would be one of the key things. But we are seeing a lot of these are case-by-case basis, and we just encourage families to talk with their worker or ask to speak with a lead worker if they have questions or concerns about their benefits. So any questions on those, or other questions that weren't in that mix that you guys have?
I'm not seeing any hands. And I do want to ask, I know there are some people who cannot get on the GoToMeeting. I'm not quite sure why it's so limited today, but are there any questions from someone on the phone? No. Okay. Thank you so much, Jen. This was really helpful information. Is there any possibility we could have, I mean, we've got it, this is being recorded, we've got everything you said. I'm sure you've sent out documents, but maybe you could send out kind of an updated document that states, until you hear it for otherwise, please know this will continue, the policy changes will continue.
Yeah, and we're hoping to have more. I mean, we're working with ELD on the future policies and the either end date or change dates when policies will be changed. So we're hoping to have more updates coming up pretty soon.
Great. Thank you so much, everyone, or Jen and everyone else, for bringing forward these questions too. This is really helpful. Okay, so moving on, we do have a debrief about the provider connections through the webinar. So that was held on Thursday in English and on Saturday in Spanish. So I know some of you were able to attend. Joan is going to give us an update. And this section actually is a two-part section because a lot of this debrief will bring up questions that came up regarding the new ECC guidelines. So we have Amy Joyce from Office of Childcare on as well. So I think this is kind of going to be a flow of getting the debrief and going through any questions people are getting from providers or questions you may have around clarity. So I think with that, why don't we go ahead and start? Joan, if you want to fill us in on that great debrief you gave us the other day in our team meeting.
Sure. And Amy, of course, you should jump in. I sort of consider you a co-presenter on any thoughts you want to share associated with these webinars. So I believe I shared with all of you a couple weeks ago that one of the things that the Early Learning Division wanted to do was to be able to open up some more accessible channels of communications for us to be able to talk directly with childcare providers. Because of the variety of concerns, questions, misunderstandings, myths, I mean, I could go on, associated with the operation of childcare currently. And then last week with the release of the sector guidance for childcare, which I know Amy will talk a little bit about and also can answer questions, it seemed timely to start those calls. We had quite a showing on the call on Thursday. We think we had about 800 providers on. We reached our limit on the Zoom meeting pretty much almost instantaneously. And then also where I know I saw some of you because I was there on the Facebook live stream, we had about 300 folks. We took in an enormous number of questions. Amy, I don't even know if you would guess at how many we received, but many questions. And also answered some questions. We were fortunate to have on the Thursday call someone, a physician, public health physician from OHA. I would say that in the ideal world of the folks participating in that call, every single question would have been answered before we hung up. And it was frustrating for people that could not occur within the time frame. Since that call, there's been a tremendous amount of work going on at ELD to update FAQs, to prepare other materials, etc. And of course, we've received direct feedback from childcare providers since then in a variety of ways. So I guess what I really want to communicate is that we had an important first foray. We definitely learned some things from doing the call, and we intend to do more calls going forward, which I'll talk just a little bit about. Then the Spanish language call we held on Saturday, also hosted on the Zoom, and then on Facebook where I was again. Not 800 providers, but pretty good turnout of folks. And then also very fortunate, our OHA public health physician for that call was a fluent Spanish speaker. The entire call was conducted in Spanish. There was a great dialogue that went on between Miriam and our public health physician. I think it was very helpful. A lot of questions got answered, very conversational. I think that's the tone we'd like to get to. It's hard to do that with 500 or 800 people. So I'll pause there. Amy, I don't know if you want to offer any reflections about the calls as they happened, any takeaways for you?
Yeah, thanks, Joan. You know, the call on Thursday was challenging. The guidance had just come out. Providers understandably had tons of questions and want to get just down into the nitty-gritty details, and we didn't have some of those answers, and there's frustration. But we tried to work through what we can. I think all told, there were something like 500 individual questions, but really when we grouped them together, you know, there were about, you know, 15 or so topics really. And we used those to put up FAQs on our website to answer them immediately. So I think it is, you know, and then the Spanish call on Saturday was fantastic. I think, Joan, I don't know what if you're bilingual at all, but I think I was, you know, the only person on the call who didn't understand what was going on because I was the only non-Spanish speaker, but I could just tell from the flow, it was this fantastic conversation and that the OHA doc seemed to be a beautiful Spanish speaker and seemed to be a great conversation with providers. So that was great. I think as we move forward with these, they will improve in that it won't be this huge crush of new information. It will not be that. And so we will be able to have more nuanced discussions and have it be more what we all want on the ELD side of things is have it be more of a conversation and not a, you know, you need to do this and just answering, you know, questions, but conversational, including, hey, providers, tell us what your experience is so we can do better and take into account what you're living on the ground, right? And your practical realities so we can ask those questions and say, oh, maybe we could do it that way and be productive moving forward and not just, you know, wag our finger, so to speak, and say, this is what you need to do. So that's what I'm looking forward to, and I am truly optimistic and hopeful that that's where we will be able to get as we move forward doing these.
Thanks, Amy. So for this coming week, we're not planning to host calls. As of last night, I think what we're going to do, and this hasn't been 100% finalized, so I'm forecasting for you, and then we'll confirm, is that we will be creating a recorded webinar where we can conversationally talk through the top key questions that seem to be the themes that providers are having, and to be able to do that in a way that it isn't just dependent on people reading the guidance, because from the questions, it appears as though, you know, while the guidance might be digestible for many of us, it's definitely proving to be a bit more challenging for some of the folks who really need to understand it. So hoping, and we'll alert you if this is going to happen, to record this webinar and release it, and of course would be asking you to share it as well. And then again, I'm forecasting, this is not 100% certain, but I do believe then that what we'd like to do, at least for several weeks, is to host calls by provider type. And so to offer calls, for example, just for registered family providers, just calls for certified family, just calls for certified centers, also recorded programs, and probably eventually license exempt. Obviously, we will want to work with our union partners on those calls, but just to try to get the size of the population of people that might be interested in participating a little bit more manageable, and also to have like shared issues among all. And of course, we would continue to host a Spanish language call. So more to come on all of those possibilities, but I think what I want you to take away is that we still see this as a time when we think extra communication, two-way communication, where there's an opportunity to ask questions and problem solve together, is something that's vitally important to enabling people to take in this important, you know, we have the temporary rules, we have the guidance, and we have right now guidelines. And each one of those elements plays a different role in all this, and we need people to understand how those work together a little bit better without having to be at such a high level to digest that. I know I'm talking to partners and colleagues who really understand that. And so I think that's probably about as much as I can say at this time. I'm happy to take questions. I'm sure Amy would too, if there's specific things about these provider calls that you would like to share or ask about what we're thinking. Okay. All right.
I see no hands.
I see no hands.
Really quiet.
Yeah, they're probably imagining all their DUNS number work that's coming. If I was them, I'd be thinking about that. So it's all going to be fine.
I did see Karen. I did see Karen Hinkemeyer applaud though when you said that they were going to be provider type. So I think that was definitely a positive, and seeing nods doing this by provider type will be really beneficial. So that's great.
Well, then I'm going to turn things over to Amy to be able to talk to you about the new guidelines. Hopefully you all have some questions. We'd love to hear what you're hearing from providers. That helps us know how to improve. Thanks a lot, Amy, for making time in your day to be with us today.
Yeah, thanks for having me. I appreciate the invite. So I'll go through a couple of items that seem to be the biggest changes from where we were before. So I'll tee this up.
Amy, do you want the screen? Do you want the screen, or do you want me to put the guidance up?
Oh, if you can put the guidance up, that'd be great. Thank you.
I will do that. Okay.
Okay.
Thanks.
So if we start kind of before the new guidance came out, right? And the initial confusion that a number of people had was this sort of belief, or the way they heard the governor's presentation leading up to this, was that, you know, childcare was reopening, which is not what the governor said, but, you know, things got conflated, reopening Oregon and, you know, new childcare guidance. So we had a number of people who thought and asked us, does this mean I could just open my childcare on last Friday? And, you know, the answer is no. We, you know, have been under this emergency childcare sort of construct since, you know, mid-March, when the state sort of shut down. And you know, the basics there, which you all know, but it's, you know, if you're licensed childcare, you need to apply to become emergency childcare, by which you know, agree to comply with the various requirements that are put out, the safety and sanitation and the 10 stable group, and prioritizing the essential workforce and all those things. And so that's continuing. And so folks who want to reopen already could do so. They could still apply to reopen if they were at that point, and they can continue to do so. So that's one big item that was sort of a misunderstanding among some folks. Another big misunderstanding is this idea in some sectors of the economy, right, that things are happening county by county, or we have these phases, that sort of thing. That's not the situation for childcare right now, at least, and I have no indication that this is going to change. Childcare is a statewide concern. It's statewide level guidance. So it's not as if, you know, in Baker County, where they've, you know, quote unquote reopened, versus Marion County, where we have not been reopened, that the childcare rules are different. That's not the case. It's a statewide concern. And again, I have no indication that that's going to change going forward. What I do think will happen is that as time goes by and we as a state get, a better and better handle, hopefully, right, on the virus, and things continue to improve, that the restrictions that do exist will continue to sort of, gradually lessen. But again, as a statewide matter. So those were two of the biggest misconceptions, I think, coming out when the new guidance was being released on a Wednesday, going into effect on a Friday, on this immediate past Friday. And then the other thing is, I think some folks thought that there would be this big change in what the rules were from the prior to the guidance coming out to the new guidance would be significantly different. And the reality is it's not significantly different. There are a handful of changes really. So people who were in the mix already doing emergency childcare really had just a few shifts to make to be in compliance. And some of those were sort of a relaxation of some things. So I'll jump into it's kind of those bigger items, right? And if folks have questions, if you want to throw it in the chat or jump in, and I'll do my best to answer questions. So one of the bigger changes was this idea of the 10 stable groups. So right before it was you needed 10 stable or consistent children in a group. That's who you could serve in that classroom. The small change that happened in the new guidance is that you could have 10 kids in the group, but only 10 could be, excuse me, did I say 12 children in the group, but only 10 in the classroom at a time. And this is hard to explain. And then our colleague, Sarah Michelson, came up with a great analogy for this. So if you think of it like a sports team, you can have 12 people, 12 kids on your team, but only 10 can be on the field or playing at one time, right? So you can have them switching in and out, but only 10 in place at a time. But having 12 kids in your cohort or your group allows for things like AM, PM switching or days of the week switching. So it's a little bit of leeway for providers and families to have, a little more capacity, but again, only 10 kids on scene at a time. Another change was, this idea of prioritizing the essential workforce. So that remains, prioritize the essential workforce. And this is my persistent plug for people to go to the website and look at our link about what essential workforce means. Another persistent rumor or belief was that essential workforce meant medical professionals, fire, police and EMS, and grocery store workers, and like that was it. The reality is, if you've looked at that document, you probably all have, the essential workforce is a huge portion of our economy. And so many people qualify as essential workforce. But so under the new guidance, right, prioritize the essential workforce, but you could also start sort of welcoming back the families, if you're a provider who has consistent families, welcoming back some of those people who are going back out into the workforce. So it's just a little bit of a relaxation on who you're prioritizing. And of course, as I always repeat to people, that guidance was, or requirement was never, you may only serve the essential workforce. It's a prioritization, and between providers and families, they do have, some flexibility and some, decision making around that topic. So that was one. Another one that's a little bit minor, but is probably going to help some people, is that as kids and staff show up at the childcare in the morning, typically, that you no longer have to take their temperature. You do have to get them to say or commit that they don't believe that they or their child has a fever. And if they can't say that, or if you have any question, then you do need to take the temperature. And of course, if a provider wants to take everybody's temperature, that's a business decision. You can make that choice. But again, that fever level of being 100.4 degrees Fahrenheit or higher, then you get into that exclusion area. The other floaters and staff doing health checks are supposed to be wearing masks. This is a challenging one, and we're actually going back to OHA to get a little more, to do a little more back and forth discussion about the mask issue. So the guidance right now says that if you are doing that health check in the morning, regardless of the kind of facility that you are, that you need to be wearing a mask. And our, particularly our registered family providers and some of our certified family providers went, well, that's weird. I mean, I'm the one, right? I'm these one staffer, and I'm required to wear a mask while I'm doing the health check, but after that I can take my mask off. Like, it's a little, what? So we're asking Oregon Health Authority, like, this is, you know, for the reality of what childcare is, does this actually make sense? So we're asking that. But at the moment, that's the guidance. You have to wear a mask in those situations, and after that, it's voluntary, except for floaters. One that's been pretty confusing, and we've wrestled with it too, and this is what I would describe as really a little bit tighter than it has been in the past, is the sort of the exclusion or quarantine rule. So if you have to, you know, when do you have to tell a kid or their family that you're excluded from childcare for a time? And this one's been pretty challenging the way it was written. You know, we got some questions about, you know, so are you telling me if a kid shows up and they have just a little bit of a cough, we have to send them home for 10 days? And then do we have to send home the whole childcare, right? And, you know, there's a little hyperbole or you know, angstiness there, but no, of course, that's not the answer. But we needed, you know, something a little more concrete from OHA about that. So we have put up on our FAQ site a really, I think, clear sort of, you know, almost, it's not a flow chart, but it's sort of a, if, you know, do this, do this, do this, description of when folks need to be excluded, when folks need to go into quarantine, and some pretty critical definitions, like what does fever-free really mean, right? It means less than 100.4 degrees Fahrenheit for 3 days, 72 hours, and you're not using fever reducing medication, right? You can't take Tylenol to get your fever down and then say you're fever free. So we've got some important information in there. Yeah, if you're trying to look for it on screen there on the FAQ, I don't think it's under, you're under,
I think you need to scroll, you need to scroll up where you were at the top.
Okay.
Up further, where it says exclude staff or children, right here. Keep going down.
Oh, wait.
You'll see it says.
Okay, sorry, I missed it.
In the.
Oh, there we go.
Yeah, right there. Yeah.
Okay. Okay. And then there's questions. Got it. Great.
Yeah.
Everyone can mark that. Okay.
Yeah. And if there's any question about that, I think we're even going to put out like a TA document or an infographic or something, because this is a consistent question and it's challenging, because you get it, is it 10 days or 14 days? And, you know, what if I come in contact with somebody with a presumptive case of COVID, but not a confirmed? I mean, there's a lot to this, and we understand that. So we're trying to get more crisp on describing what the requirements are. And I'd be happy to send out Joan or Margie after this, the sort of bulleted list that's in a little different format than this Q&A, to help people understand like what the requirements are on exclusion, because it is a consistent question and an important one. People have a lot of anxiety or anxiousness about making sure they do this right, I'm sure for a number of reasons. Right? So those to me are the big changes. And I'll pause there and really invite any questions. I don't know that I saw any questions in the, oh, okay, I do see one question in the chat from Lauren Peterson. Any specific guidance in the FAQs? What the protocol is for a confirmed exposure in the program? So 2 things on that. always, always, always contact local public health, report it, and really you provider may be receiving that information from public health, but report to public health, and then yeah, that FAQ and then the bulleted list I'm going to send to you should be pretty clear in terms of what you need to do in terms of excluding people or not excluding people. I will say that to date, you know, what are we, two months into this? March to April, yeah, about 2 months in. There is a handful of cases. I mean, I think 10 tops, even around childcare. So whether, I don't know that we've had any with a child who's been confirmed COVID. We've had a couple where a staffer was, and a couple where it's like the parent of a child, that kind of thing. And I think everyone that I've seen has been, you know, the teacher left being in the provider's facility like days and days and days before there was a positive test. You know, they felt a little ill and they stayed home, right? So that key recommendation of if you feel sick, stay home, right? And then think through whether you need a test or not. So it's been really, really surprising, happily surprising how little of this has gone in childcare when you think about how, you know, the little ones, right? They're not going to socially distance. That's unrealistic, and we know that. And so it's been great, and I think a testament to what our providers are doing in terms of hand washing and cleanliness and cleaning and being aware and having people not show up when they're ill. It's a testament to what they're doing right, and they should be applauded for that. So, but that's the situation in care. Let me see if we've got any.
Great. Amy, I think we have a, Toby had a question. She was raising her hand, and then we do have some in the chat box too. So Toby, do you want to start?
Well, it's more of a comment. We did a staff meeting yesterday, and staff was following the live stream with the meeting with providers on Thursday, and they even got phone calls after that saying that licensing, they had multiple licensing specialists, and what they're getting from each licensing specialist is a different answer to the same question. So they didn't know what guidance you guys are providing licensing, that they talk to one licensor and the licensor says do this, and then the next one comes in to do their, you know, virtual visit, says no, it's supposed to be this way. So there's some confusion there on what interpretation of the guidance, I guess, is there's some confusion on what they should do.
Yeah, thanks for that feedback. So, I mean, I'll say a couple of things to that. Since I've started here, right, this is something we hear, you know, well, one licensor tells me one thing, one tells me something else. So there's that. We have 60 licensors in 8 different offices around the state. We do our best to stay consistent, and we are trying to do that now. And now we have new guidance coming out that's a whole lot of new information that we're trying to wrap our brains around and get additional feedback from health authority in terms of, well, do we really mean this? What about this situation? So we continue to provide updates almost every single day. We put out FAQs internally for staff to learn about, you know, what does this rule mean? What should we do with these kinds of situations? So we are working very hard at trying to be consistent, and we will continue to do that. And, you know, I'm not gonna pretend that folks don't sometimes get different answers depending on who they're talking to for many different reasons. We are working really hard at that, and we will continue to do so.
And Amy, to that, I think also, and as Toby and others have talked about, it's also that consistency in the quality improvement specialists in the CCRR. So I think as the communication between the licensing specialists and QISs continue to strengthen, I think that will happen. We'll have more of that consistency. So I appreciate, you know, the efforts that are being done across the board.
Well, hey, Margie.
And the FAQs help guide that as well. Yeah.
I think there's definitely situations where you know, there's examples that this happens with licensors, but there's examples, I think, as you're mentioning, Margie, that it happens with QISs giving sort of a different angle than the other QIS gives. And I want to caution everyone to ensure that we aren't also taking bait that might be a provider trying to get to the answer they really want. I mean, we know that people have different suggestions just in processing information, but if a provider's connecting with multiple licensing specialists or multiple QISs, sometimes they are also hearing what they're, you know, wanting to hear, and they want to get to the thing that they want to have happen. So I think the best thing we can do, in especially this time, is to really make sure that we're connecting with our licensing specialists. And even if you can, and I know this isn't always possible, but if there's ways that you can sort of do a direct connect with the provider in the moment, because they're going to be asking you licensing related questions. You can go to the FAQ, you can read it directly to them, you can give them very clear guidance around that. But sometimes there's these gray area questions, like, or what are in the chat box right now. I think Nancy has a great one that we'll get to in a moment, but it's like, those are the ones that you're getting, whether it's intentional or not, you're getting pitted against each other. And we need to make sure that we're getting the correct information out at all times and connecting with the people, so that you and the licensing specialist can talk to the provider at the same time and basically just say, hey, this is our understanding of it, or hey, we're going to go seek additional information because neither of us have the answer for that, because this stuff is coming at us fast and furious. But I think that the same thing is occurring on licensing side, where they're saying, well, the QIS said, and we don't want to get into that. So the more that we can connect back to each other is, you know, we've got to be unified in all this, because this is our most critical time to make sure providers have exactly the right information, because we know that even some of the stuff that they were guided on in the beginning, they're having trouble implementing in full. And so we need to make sure that we're getting that message as clear as possible. So just a soapbox.
Yeah, and I really appreciate,
thank you, John.
I really appreciate that, John. And you know, I think you all know, as professionals in the kind of work that you do, and I'll reiterate it now that, you know, John said it, you know, all this stuff we have to take with a grain of salt, you know, whether it's intentional or not. People may hear what they want to hear, or they might be on a fishing expedition or whatever. I mean, just early on in this crisis, I had a conversation with a provider on the phone, told them what the, you know, interpretation of the rule was, and she went on Facebook and said, well, Amy Joyce, director of OCC, said X, and I said, I didn't, you know, like, that's not what I said, you know. And so whether she heard it wrong or was intentional, so grains of salt all over the place. That direct connection, that sounds great. I didn't realize you guys did that with licensors, and yes, sometimes we're going to get it wrong. So all yes and all that stuff.
Thanks, Amy. So in the chat box, Eva, you are next. Do you want to talk about your question? Yeah. Are you there?
Sorry, I'm like, mute. Here's the mute. I'm just wondering if there is conversation happening around timing with getting licensing specialists back out in the field to license new providers. We continue to have a team conversation about school districts closing, and where that leaves a hole for us, and where we're getting new regulated subsidy providers who want to become licensed providers. We're getting them ready to, as we had a conversation yesterday, knock on the door of licensing, and one of my team members said, so how do we know that licensing will open the door? So I'm just wondering, you know, what kind of conversation you're having around that with timing, and wanting to make sure that we're lining people up in a way that's going to feel productive on both sides.
Yeah, and thanks for that. So, right. So the lay of the land has been that during this crisis, unless a prospective provider had already had at least one in-person visit for the licensor to see their space, we weren't going to process new applications. So that's where we are right now. But as this goes on and we see these pressures of, like, right, the school district shutting down, and, you know, the the pop-up situation where we need to work on winding those down. And the desire for folks to become licensed care, how are we gonna figure that out? And we're thinking through it. So there are a couple of different things we could do. One is to ask licensors to go back out in the field and do in-person visits. That's challenging because the provider themselves may not want another human being, potential, transmitter of the virus coming to their place. And some of our licensors are not willing, for very good reason, to go back out into the field, whether, some of them immunocompromised and all the other reasons that people are, right, or, socially distancing themselves. So we've got that challenge. On the flip side, what can we do with that? We could do virtual visits. They are an imperfect substitute for an in-person visit. You're to some degree relying on the trustworthiness of a provider who maybe you've never met and don't have a relationship with, and therefore what's the basis for that trust? To be able to, are you really showing me all the parts of your house? I can't do my own measurements. Do I have to rely on your measurements? So there's that thing, and there's a competing values, and we need to work through where that lands. The other part of it though too is, and I don't have all the rules square in my head, apologies, but for some facilities, you need to have a visit from the sanitarian and the fire marshal and maybe even local planning. And so what's happening with those entities? Does it do you any good if we go, okay, we're going to come do our visit and get y'all squared away, and you let me know in 6 months when the sanitarian's going to start coming back out, right? And so that's another aspect, the things we can control in person versus virtual visit, and the things we can't control, like our fire marshal and sanitarians going out. And if they're not willing to do virtual visits themselves, what do we do with that? Do we say we give you a pass for a little while until people open back up, or not? So those are the kinds of things we're working through, and I would welcome feedback, maybe not in the moment. I mean, you can if you want, but maybe some suggestions from folks if you have them, and how we wrestle with that problem, both of those problems.
Thank you, Amy. Nancy, you want to talk about your story?
Okay, I will keep this brief because it is a very specific one. First of all, I want to say a very special thank you to Amy because she came to a gorge-wide training last week with very short notice and did a great job with our providers. There was one provider there on that call that was talking about her classroom, which is large, in which she wants to divide into 2. But to do that, you have to go through one classroom to get to the other classroom. And she's looked at a variety of things. This is the woman who was talking about perhaps making a spaceship or a space costume. That's the one. Highly creative, and I love her. She wants to do what's right, but she's talked to the licensor. The licensor's going, I don't know what to do with this. I know she had talked to you. So where do I send her to get those kinds of answers?
Yeah, so my very unsatisfying answer is we're working on that one. So I think this is a CF home, potentially, or is it a center? Do you remember?
Actually, it's a center.
Center, okay. So the question becomes, do we say, like, maybe even have a designated aisleway off to the side where that's where the kids go back and forth, and they do that as infrequently as possible. We're looking through those things. Our, one of our struggles is we can't necessarily just make these decisions by ourselves at OCC ELD. There's the partnership we have with the health authority, and that's, that aspect is a health kind of a question in terms of trying to limit the interaction of the kids and keep the density of kids down. So that is one we're definitely working on. So I would, and this is, I understand, an unsatisfying and frustrating answer, but we're working on that one. for not just for this individual. This is a question from many.
Okay, and she's going to send me pictures of her classroom to kind of give us an idea of what she's thinking about. And would you like me to send those on just to give you an idea of what this situation looks like?
Yep.
Okay, perfect. Thanks, Amy.
Great, thank you. And Christine, you have a question.
Yeah, and I don't know if this makes more sense for our meeting on Thursday, but in meeting with the Oregon Provider Relief Guide yesterday, we were hearing from coaches that they were getting requests for some templates for some of the new logs that are being asked to keep, like attendance. I think there was a couple extra things added to that. And so I was just curious if that was something that OCC or ELD was thinking about putting out, or if that is something CCRR should be thinking about developing, just some sample templates.
So Christine, so I heard attendance and the new, I think there's 1 or 2 additional items for attendance. Were there other templates you were looking for as well?
I'd have to go back through the new requirements. They were just saying there was a couple of new documentation things that they were needing to keep. And I'm sorry, I can't remember them on the top of my head, but there was more than one for sure. There was the attendance and there was another one.
So I'm pretty sure the attendance log without the new guidance has been up on the website for quite a while as a resource. So I will look at, adding whatever 1 or 2 new things and getting that reposted. Joan, does that sound like the right answer? I'm going to look to you for guidance.
Yeah, I think if we could modify that, Amy, like make sure it aligns, and then we could communicate that it's available in the sense of reaching back out to this group of folks to let them know that, and then of course flagging that for licensors too, who might end up with the same questions, like is there a specific format we're supposed to use for this?
Okay, so I'll ask somebody in my shop to go to work on that right away.
Thank you.
Thanks. So it looks like, Amy, there are just some more comments in the chat box, such as the weekly calls and Eva's region with licensing specialists are really helpful, and definitely a way to connect in a positive way and supportive way. And then also in Toby's region, she's brought this up before, but there are several regulated subsidy providers lined up ready to become licensed, as well as Lynette in the Lynn Benton Lincoln area, registered family are ready to become certified family in response to preschool promise. So just an FYI, for we do have some lining up, which is pretty exciting. So once we're ready to get that going again.
Yeah, and I want you to know I hear you on this, and I said this on the call with the other day on the Rogue, I think, or excuse me, the Gorge meeting. I think it was there, where there are things that keep us all up at night, right? And one of the things that keeps me up at night is this whole question of the equilibrium, right? So right now we have more slots than we have kids, we think anyway, by a fair piece. In normal times, right, we're a childcare desert, we don't have enough slots. How do we try to get to some sort of equilibrium? And to me, part of that calculus is as those schools wind down, as the pop-ups wind down, we've got to get these other providers who are wanting to, become licensed care or expand from RF to CF, whatever it is, and have more slots. We need to get them through the process, and we need to figure that out. So we're thinking through that. We're actively talking about it. And again, I welcome your suggestions on the way you think best to do those kinds of things that I talked about, those 2 issues about virtual versus in person, and then the externals, right, the fire marshals of the world, and how we crack that nut. So please let me know.
So on that note, Amy, that invitation, I'm wondering, Hannah, I'm not sure if you're still on, but John and Lisa, we might be able to add this to the Thursday meeting if there's time, and we could have some dialogue about any ideas and suggestions that all of you have that to support this. reopening. And it's funny, Amy, that keeps me awake at night too, along with several other things. But that's been one that I've been, how are we going to scaffold this? How are we going to do this question? Get ready for opening. So, and then Lynette did have a question. So either Amy or Joan, it goes back to the DUNS requirement, and when will licensing specialists be notified of providers meeting this DUNS for their grant awards?
Yeah, I can answer that. So Betsy did a webinar this morning before this call with all of OCC staff. So we had like 80 some people on that call and recorded it so that others can look. So they were notified at that time.
Great, thank you. So are there any other questions for Amy? Thoughts, comments? Any for Joan regarding the webinars or for the providers? Okay, I'm not seeing any hands or anything in the chat box except thank you. This has been great. Thank you so much,
Margie,
Amy.
this is
Thank
Margie.
you, Joan.
Can you hear me?
Oh, yes, yes.
You can?
Is that
Okay,
Danae?
I'm sorry. I was trying to figure out how to raise my hand or unmute or something. I do have a quick question. I had a director who asked me the other day if right now with high schoolers not being in school, how she could utilize high schoolers without being able to put them in the CBR process because they're not 18.
Yeah, so gosh, this is where my my newbiness, I'm going to claim the newbie card. So what we set up when the pandemic hit, or when the crisis hit, was, CBR is ideal, but we did set up an emergency background check system, which is incredibly quick, is free, as is CBR application, and does not require fingerprints. So that is available. But if you want to shoot me if you want to shoot me an email, I can get you more detail on that, because it's escaping me right now whether if you're under 18, whether you need to be to even go through that. But I don't want to give a wrong answer on something that important. So if you could email me, I'd sure appreciate it.
I will, Amy. Thank you so much.
Great.
Great.
Thank you all for having me and for your partnership. And I encourage you at any time, if you have questions or whatever, let me know. And it's a pleasure partnering with Joan and with all of you. Thank you.
Thanks, Amy.
Okay.
Bye.
Bye-bye.
So we have a little less than 30 minutes left. So instead of taking a break, if you do need to take a break, please do. But let's go ahead and move forward on the agenda. What we have next is really kind of a communication section, and we have, kind of communication both ways, hearing from you as well as us sharing. One of them was the FAQ's consistency, and I think we started that conversation earlier with Amy, so we may be able to pick that back up. But one of the first places we wanted to start was around the connections with regulated subsidy providers, the DHS listed. And John, I'm going to hand it over to you to kind of frame this and start the conversation, if that's okay.
It's really not, but it's fine. Just kidding. So I think regulated subsidy providers, for various reasons, are going to come up today and a little bit on Thursday as we talk through some aspects around the providers that are sort of out there right now doing emergency care, but because they don't go through an emergency care, application process. Some of them are known to you as CCRNRs, and some of them are kind of just sort of dangling out there. And I think some of what we're trying to get a pulse on, because as Miriam and Joan and others are working with SEIU union representatives and looking at, and I should also mention Sandy's been in the middle of all this stuff. We're working to make sure that the collective bargaining agreement is solid and that we're following all of the things that were agreed upon within that. And that's where I'm saying Thursday there's some additional discussion that we're going to have around ensuring that we're fulfilling some of those requirements. But in different regions, I know that some CCRRs are fairly actively going through their regulated subsidy lists that come from DHS and recruiting them in as much as possible. And others have very few regulated subsidy providers that are sort of on the NACRAWare system and are not having as much regular contact with them. But we kind of want to get a pulse of sort of how significant that push has been during this emergency period. Of those, I also think it's important to understand from 211's perspective, have there been a lot of requests for providers that are not registered or certified, and are they sort of showing up on the pool of providers that are sort of available in this emergency response? Because I think the union has also been pretty interested in understanding how we've been able to sort of bring them into the emergency response that exists when they are folks that really want to be a part of that solution. So I kind of want to pause for a moment because I think I crossed a couple of things, what CCRRs are doing, what 211 may be hearing or doing as they're referring out. But I'd like to get a little bit of a pulse on how well we've been able to, and if the pulse is, we've been doing updates and haven't been able to prioritize our regulated subsidy at this point, that's good to know too. But I think we just want to start having some dialogue around this, and we will have additional conversation here for our Thursday meeting that revolves around ensuring that we're fulfilling some of the requirements around interactions with them. So pausing, I see Shannon and then Toby and maybe some other folks. Go, Shannon.
Okay, yes, we've been using the list to make calls to our exempt, because we were asked to look at who was still doing emergency childcare. We're actually finding quite a few that are still doing care. We've actually been sending quite a few of the DHS orientation packets. There are still some that we can't connect with, but we definitely have been able to make connections on who's still doing care, and it seems to be going smoothly, at least on the person who is doing it for me.
Shannon, this is Margie. I have a quick question around that. What is their response when you ask if they want to be, if they're not enrolled in NACRAWare and you ask if they want to be enrolled in NACRAWare, and are they open for referrals? I mean, what are the responses you're getting around that?
So normally it was part of our, when we were doing face-to-face classes, it was just part of the orientation. So when now with the packets, we put an enrollment form in there, and then when she does the follow-up call, that's where we have the conversation on whether they want to get into the system or not. If they don't want to get in the system for referrals, we were asking them to get into our system for the newsletter and training guide, so we'll have something. So they go onto a separate list for that. So one way or another, we have some sort of contact point, because it could be grandma who doesn't want to be on NACRA, but we'll at least have her on a list for communication.
Okay.
So most of the time, either one or the other, they're happy to do that.
Okay, great, thanks.
Go ahead,
this is Lisa.
John, this is Lisa. I'm glad that Shannon touched on the newsletter piece and the referrals piece, because that's one of the things we're really trying to better understand is, you know, as you're talking to providers, is for those of you that might know, what percentage of regulated subsidy providers that are in your area do you have in NACRAWare that either want to receive referrals or would at least like to have the newsletter? Great.
That's good.
Okay, I think Toby was next. Yeah.
We did the same as Shannon with the emergency supplies. We were able to contact more of the regulated subsidy and the exempt providers and reach out to them. And we've been able to add them to NACRA for even just the newsletter, but it also got those providers interested in, because they were getting asked to care for more families, we got several of those providers to apply for emergency childcare. Because they've been doing regulated subsidy, and a lot of them do trainings every month, and they had their CPR, their first aid, you know, everything they required to do that. So I even yesterday, a provider goes, my central background check is still in pending. It was submitted before COVID. Do you know what's going on with it? Because I want to get going. I'm doing emergency childcare right now. Was approved for 10, and I really want to get licensed. So a lot of our ECC or our regulated turned into emergency childcare providers. Beyond their 3 children that they were caring for. So we were able to do a lot of reach out.
They were essentially part of the emergency childcare solution that was sort of in that pop-up group, but they went from almost like a regulated subsidy to a registered program, but they aren't official, right? Because they have to go through
They're not official because they don't have that visit, but our licensing specialists go out there to do their regulated, when they're becoming regulated subsidy, they do the visits. So I don't know how, with that thought, because they've been out there, they do the health checks with them, why they can't convert them to license if they've already been out there, you know, in previous, right, when they were going to the program. A lot of these, like I said, they've been through, licensing's been there. We've been there doing checks because we go in and help them get ready just to show them, you know, what it looks like. And, you know, we were doing all those visits prior to get them ready for the licensing specialist, just to see if there's anything before licensing got there to correct, so they wouldn't have any issues. So I don't know how they could convert them to a licensed facility if they've already been out there for DHS, for exempt, for the regulated subsidy. So we constant emails, and they're even coming to me now, straight to me, because they're going, we're waiting to get licensed. What's going on? What can we do? Yeah, I think that's a good consideration as we're talking through with Amy and they're creating their plan. If they have had some face time with those providers, is there a different way that we can track them into getting registered? But yeah, that's good. Let's see, I see Shannon and then Carrie.
I just wanted to reiterate on that too, because we've had a lot of calls of providers who want to become licensed. And so I sort of move them in the exempt direction for the time being. You know, do all your classes, do all these things, and you know, set yourself up as an exempt for the moment. And then as soon as licensing opens up, you'll be pretty darn ready, close to do it. But at least they could take on at least 3 children to get started. So I've been sort of moving them in that exempt direction until we can get them licensed.
That's good. That makes sense too. I see some things in the chat box, but Carrie, go ahead and.
Oh, I was just going to answer. You said you wanted to kind of hear some feedback about what parents are asking for. Yeah. We're getting a lot of calls from employers that are calling for the parents that work for them because they're going to be going back to work. And so what they're asking for is just like a big, huge list of all the emergency providers in their area. And they're not as concerned about like licensing and things like that. They're just concerned about who's going to be able to take care of the kids. So that's kind of more what we're hearing right now. And then we're getting calls from parents that need DHS listed providers as well. but they just don't understand the differences in the licensing. But yeah, just a lot of employers though calling just to get the entire list in their area.
And do we, this is a ignorance question on my part, do we have then the regulated subsidy providers that are currently active? Do they have the emergency childcare designation on there, or are they just, if they're just active in a referral status, we're just assuming they're taking referrals? They don't have the EPC designation, do they? The regulated subsidy?
They do if they've responded. They're under there as emergency childcare license exempt. So
okay.
Yeah, we see it as exempt, ECC exempt. So yeah.
Okay, perfect. That's all I was curious about. But thanks for that,
so John, there's some chat.
Yeah, I don't
respond. Do you want me to help you with that?
Especially Danae's, because they're 14 miles long. Sorry, Danae. I adore you.
And Eva was also saying that she's been the small region's been able to call providers weekly, which is great, but it sounds like there's some furlough going on. So I'm sorry, Eva, that's tough. Danae, do you want to talk about what you're doing? Just have to get off the mute.
Yeah. Today's been challenging. I actually just lost audio when Carrie was talking and had to hang up to call back in to get my audio back. It was very, very odd. So I called in with perfect timing. So I just want to make sure, Margie, that you're asking what we are doing with regulated subsidy providers, correct? Because that's where we left off. Okay. Yeah. So we initially, when the call went out to inform all of our RS providers about the emergency supplies, our staff called everybody in Acroware in our region who was regulated subsidy. And what we found was there was a very, very large number, and I'm talking like 40 or 50 people who were no longer providing care. And we were under the assumption that when people expired as a regulated subsidy provider, or they inactivated or stopped doing care, that was being updated on the DPU side or the DHS side. It's kind of a learning thing for us so we went ahead and inactivated everybody who wasn't providing care. We did let everybody know who is about the supplies. And then now that we have a much shorter list of people that we know who are active, we can stay in better contact with them. But I will say, Margie, we had a lot of difficulty accessing the DHS screens for many, many months. And we now have access, and so it's going to be a lot easier to do that work. But it did take some time to get to that place where now we can do that work more efficiently and effectively. So that is the plan, is to take that now smaller list of active regulated subsidy providers and make sure that they are staying up to date with information and communication.
Great, great. And their response to enrolling in Acroware if they're not in there?
I'm sorry, can you repeat that? It cut out.
Sure, and what is their response to enrolling in Acroware if they're not in there?
Most of the people who are still active did say that they are caring only for families or their own family, but that they did not want to take on referrals or be listed in NACRA. And so we made sure that, I think there was only like 2 people who said that they would be willing to care for other children because they had slots open. And so we did keep them active in NACRA as emergency childcare.
Okay. Thank you, Danae. So Nancy, it sounds like you're doing the same in your region, calling and so those, you're calling from the DHS list as well as those enrolled in Acroware?
Yes, and we try to enroll any of them that are active in Acroware just so we can keep track of them. So
right. Okay. Great.
So
and then Mary, oh, go ahead, John. Sorry, I'm still going through chat.
I think it's okay that you finish the chat, and then I just wanted to mention or ask of regions that haven't necessarily responded if there's been, you know, less of an opportunity to connect with their ERDC, you know, exempt providers, or if it's similar to what everybody else is saying here. Just curious. So I will say the last chat one there, which was Mary, that she was having the same experience as Danae, and that that was true for her about the DHS screens also. And so then Christine, I saw raise your hand, and then I have, oh, and then Taya, thank you. Okay. Go ahead, Christine.
Yeah, I think we have about 500 or so exempt providers, and so we're not calling our exempt providers, but we do email out, and the newsletter goes out to, we use the ERDC, or the listed list that we get from DHS, and that we do email all of our information to that list. We email our newsletters to that list as well. And so they've also been getting, anything we send out goes to that list as well. So they're just on our traditional communications, but they're not all in NACRA.
Do you, when you email out to them, Christine, do you ask if they want to be on NACRA, that they can contact you or anything like that?
Occasionally. I mean, it's not in every single communication. We definitely do that at the orientations. That's kind of where we try to hook people in, much like other people said. We actually get a lot of resistance to being in the database from a lot of our exempt folks. And so we really don't push it. We do tell them, you know, of course, you can just be on the newsletter list, but they get the newsletter anyway. So I don't think it's not a great incentive in our area.
Okay. No, that's helpful, because part of what we were hearing from the union also is that these folks are feeling like they're sort of invisible to being part of the solution for emergency care. But if in the beginning they were not really interested in, being on the database, they may not really understand how they get back in, but that is all very helpful. Taya?
That's not what I meant to do.
There you are.
So we made, when we started doing, marking everybody as ECC, doing the updates and doing all of that in general, we didn't really have a lot of regulated subsidy or license exempt. And so we started to do that after probably a couple dozen calls or so. There were so many just shutting it down, not interested, and our workflow is like this. And we actually lost a couple staff members because of layoffs to our part-time hourly people, none of our QIS, but the people who do data entry normally. So we didn't really, it just ran into a capacity issue combined with the fact that we weren't really getting anywhere with those calls. But we do connect to them in a few different ways. Once they go through, so we use a separate registration system. We have to take payment for the college. So once they get into our registration system, they're in that database. And so then they go onto our newsletter list and all of that, and we communicate that way. And the other thing that we started doing was using first aid CPR as a marker. And so we can go and pull and see the last time they took first aid CPR. And when they get close to expiring, we use that kind of as a little prompt to connect with them, let them know they need to take first aid CPR, and then kind of talk to them about what other opportunities there might be.
Excellent. Thank you. And then Lynette said they call from the DHS list and offer enrollment. However, most are wanting to care for families they currently have in care. So similar to other regions, and the newsletter goes out regardless of enrollment. Macroware, cool. And Mary said they all get the newsletter. So at least you guys are getting the propaganda out, whether they want it or not. That's good. Any last comments around this? I'm aware of our time frame here, but this was part of what Miriam was really, she was getting feedback that many of these regulated subsidy folks were not necessarily feeling a part of, you know, this emergency childcare solution. And I feel like what I'm hearing is a fairly similar set of strategies across the board, minus some, you know, larger areas with capacity concerns, but that we've done a pretty good job of trying to reel people in who may or may not be at all interested in having that ongoing contact, and that they are getting, you know, other connections from us and can always reach out to you guys for more if they're interested. So thanks everybody on that one.
Great. Well, we're really close to the end of our time, and I think that what's left on here, text, is going to require a longer conversation than just 5 minutes. So we want to, let's put that on our Thursday agenda to have that conversation. And if we can't get it on there, because I know that agenda is filling up, we'll get it on next Tuesdays. And Sydney does want to do one quick update regarding the Focused Childcare Network report. So Sydney, if you could share that now, that would be really helpful.
Yeah, thank you. So I had hoped to get this, I actually had thought that I had gotten this sorted out before the report template went out to you guys, but I don't think that it did. So you see that there's the section in your report on the Focused Childcare Networks that asks about who's in your network, who's open, who's temporary closed, and who's permanently closed. We found another way to get that information. So Hannah sent out an email to all of the QIS that asked them to make sure that their list of who is in their network is up to date. There's a tracker that everybody should be putting their providers in when they join and when they leave, so we know who's in network. So we want to make sure that staff get that up to date. Once that's done, Sherry will go into NACRWare and check the box under affiliation that says network. There's a box in there that can identify people as being part of the network. So she will go and populate all those that we already know. People should just make sure that they're going into NACRWare and making sure that their people are checked on there and uncheck them when they leave. And then we can check those things ourselves. We can pull a report in NACRWare that says whether they're open, closed, or temporary closed. So you don't need to fill that part out in the report. Fill out all the other pieces still, but just that one piece about whether they're open, closed, permanent, about who's in your network, you don't need to do that part. And then I'm going to be sending a draft of the document of some emergency guidelines for Focused Childcare Networks out for you guys to look at and comment on before we finalize them. So you can look forward to that. We were hoping to have the conversation in a meeting, but as you can tell, these meetings are super packed full. So I'll be trying to do that via email. Yes, Mary.
So Sydney, in NACRWare, does it identify which Focused Childcare Network if you have several?
No, and we won't be using it for that purpose right now. So that information is still in the tracker that Hannah manages, the participant tracker. Once we move to the new system, I'm hoping that we'll be able to merge those things together and add the fields for the things that is on the participant tracker that Hannah manages. We'll have to think it through a little bit because NACRWare is a facility, tracks facilities, and there might be more than one provider in a network at that facility. So we kind of have to think that piece through a little bit. But for now, we can at least see, you know, for the region, who's open, who's closed, who's temporarily closed. I really just kind of want to get a gauge of that change and, you know, how that's happening over time.
So kind of broad.
Two other hands. Yeah.
Okay. Sounds good.
Hi there.
Hi.
I would really appreciate if when our QISs are informed of something that they're required to do, that the director is copied on that so we have a better understanding of what's being asked of them. If that could please happen, that'd be great. Also,
Hannah, I didn't look and see if they were copied on that or not because Hannah was the one that sent that out. I'm not sure if she's still on the phone or not, but yeah. Okay, so I'll email Hannah and just make sure that she gets that note to CC you guys. When I send things out for requirements, I'll make sure to include you on there for sure, though.
Great. And also, I just wanted to let the directors know that I sent a cheat sheet that Jessica made that really helps our QI specialists and our other CCRR staff in supporting providers when they have them on the call. So I emailed that to you.
Thank you, Karen.
Any other thoughts?
Christine says, just a reminder that our network coordinators are bilingual staff who are also helping larger populations do things such as apply for the ECC grant, supplies, etc. Networks are not back to normal yet. So just a reminder.
Yeah, and when I send those draft guidelines out, that's the kind of input I want. I'm really sending them to you before we finalize them so that you can tell me whether or not the plan seems realistic. Because I would really like to have, as much as possible, consistent service level for people. So somebody in one area is not getting completely different service than they are in another area for networks. But I know that just might not happen right now. There might be different levels of service, but I'm trying to figure out where we can get that minimum and still be doing a network. So take a look at what we proposed and give me all your feedback, and we'll use that to think it through.
Thank you, Sydney. Well, we've come beyond our time, 1 minute. So I'm going to say goodbye, everyone. And we will see you on Thursday. Please send any thoughts, comments, questions our way in between now and then. Talk to you soon. Thanks for coming. Bye. Bye.